So FoodMed is a conference to bring together healthcare leaders around the country who are trying to embed sustainable food purchasing into their operations with companies and with farmers that are looking for markets to market their healthier food. So we see healthcare as being a major driver for supporting sustainable agriculture around the country in support of disease prevention, in support of healthy communities. And so FoodMed is the embodiment of that marriage. Well, I think the role of healthcare in general is incredibly powerful in our society. It's 16% of the entire economy, and they're the most trusted spokespeople around issues around health in our society. So if the healthcare sector can model healthy buildings and healthy operations and sustainable procurement, can have an enormous role in society. In the same way that if you want to get society to stop smoking cigarettes, start with doctors and nurses. If you want society to kick its addiction to toxic chemicals and kick its addiction to fast food and kick its addiction to fossil fuels, let's get the healthcare sector to model this transformation, and then it has a wider impact on the larger society. So there's been a traditional disconnect between clinical care and a whole set of other factors, and that the medical profession has looked at the individual in isolation of the stresses in their life, their socioeconomic problems, the food they eat, the chemicals they're exposed to. They've missed the context that make up healthy people or that contribute to disease. It's a fundamental failure of the healthcare system and our medical profession. And what we're trying to do now is to heal the medical profession, to heal its understanding that you have to look at the individual in the context of their family, of their home, of their community, and of the larger environment. And so that is a redefining of what medicine's got to be about in the 21st century, that healthcare is about supporting people in healthy communities on a healthy planet. That's how we're going to reduce healthcare costs. That's how we're going to support a healthy society, and that's how we're going to move from a disease management model for healthcare, which is unbelievably expensive and kind of ineffective in a certain way, to one which is about prevention. So, for example, cancer deaths are down in our society, but cancer incidence continues to go up. So 1 in 2 men will get cancer and 1 in 3 women will get cancer in America. Why are we letting that happen? Why are we normalizing that kind of violence against life? Why don't we move upstream and figure out why people are getting cancer in the first place? So FoodMed and Healthcare Without Harm is about moving upstream to develop an ecological view of health and disease, and to develop a prevention and community environmental health framework for the future of medicine. So there's an epidemic of obesity and diabetes and heart disease in our society. Each of those conditions are very strongly linked to food and exercise. And so if we want to prevent that epidemic of those diseases and not just manage them, we need to move upstream. We need to deal with the fact that the food that we produce in our society, the messages we give to our children, the messages we give in schools are in support of fast food, unhealthy food, and we're not supporting healthy food systems in our communities. And so if healthcare can be a driver for changing those messages to be in support of healthy food, to kick the fast food chains out of the lobbies of the hospitals, to have farmers markets instead, to support antibiotic-free meat production in America through their purchasing practices, to support fair trade products, to support a link to organic growers around the country. Healthcare is such an enormous driver in the economy. They, along with schools and other institutions, can actually help build a new economy. And part of that economy's got to be about sustainable agriculture. It makes sense from every point of view, from a health point of view, from a local community economic development point of view, and also from a climate change mitigation point of view. So we see healthcare as central to that transformation over the next couple of decades.